Hello, my name is Ariel Dixon. I am presenting my Cultural Anthropology Project Solution presentation for Health 623 Cultural Aspects of Health Behavior. My country is Peru, and I will be focusing on the indigenous people of that area. Peru is home to over 33 million people. Of those 33, 7 million are indigenous, and within that 7 million, 55, there are 55 different ethnicities within that just indigenous population group. Geographically, it's home to some of the most beautiful landmarks that we consider, the Andes Mountains, the Amazon River Basin, and then it's surrounded by the Pacific Ocean directly. The Atlantic Ocean is sort of on the other side, but it's surrounded by Ecuador, Brazil, Bolivia, just beautiful countries with a lot of cultural history. So very diverse, very culturally strong. Additionally, it has a very culturally strong history. It was previously the home of the Inca Empire of the 15th and 16th centuries. In 1821, the Incas fell to Spain, and as Peru emerged from that period, they obviously had a lot of political, social, and economic strife, but also transformations. Some of which which has made Peru one of the strongest countries and culturally diverse countries that it is today. One of the most significant challenges facing healthcare delivery in Peru is the presence of cultural biases and medical mistrust from indigenous Peruvians to the more Western, modern healthcare delivery system. Additionally, they just have a preference for their traditional healers because that is their culture, that's what they believe, and it still does really well for them. Unfortunately, they experience things like delayed engagement with medical care due to geography, not having clinics locally in their areas, not having the resources to travel, even if it is relatively close. They may not have the car or whatever the case may be to get to where they need to go. We talked about the mistrust and ongoing discrimination. Another large part of their belief system, which is a barrier to, I feel like, the Western medical system, are the collective decision making. So, a lot of indigenous people rely on collective decision making in their healthcare. So, including, not just a spouse, but including grandparents or a community elder. Those are still important people to their value system, and so therefore they offer that respect and still believe in that. And like we discussed, there are 33 million people, 7 million indigenous, and over 55 different ethnicities. And with that comes multiple languages. So being able to communicate in a way that that person understands can also be a barrier as well. So, I am introducing Health for Life for Peru, which is a 12-month community health promotion program designed to reduce risk factors for chronic disease. We're doing so through culturally appropriate education, screening, counseling, and community support. The program will partner with local clinics, indigenous leaders, traditional healers, and community health workers to deliver services that are culturally appropriate, that are that speak the indigenous languages and respect their knowledge, tradition, as well as dietary and other health belief practices. It's not our goal at all to encourage participants to abandon their lifestyle, their traditional lifestyle, but more so to emphasize strengthening healthy food systems, providing culturally appropriate health education, and improving their access to care when they need it. I'm currently on slide 7 just so we can level set there, but to discuss my objectives, my first objective is to enroll 200 Indigenous adults within the first 4 months of the program. That I feel like is a good sample size in which to get started, and as well as see as sort of if our current plans, budgets, and all of that are appropriate to meet the current needs. Secondly, I would like to increase the percentage of participants receiving annual blood pressure and blood glucose screenings by 40% within 1 year. We'll talk about sort of how we track and assess that, but that would be the second objective. Third, for those participants who have been identified as having elevated blood pressures or elevated glucose, the goal will be for at least 50% of those individuals to successfully connect with a provider for follow-up care within 3 months. And lastly, by the end of the program, we would like at least 85% of participants to attend at least 4 of our community health education sessions. We believe by allowing these sessions open not only to the participant but to the families as well, will encourage sustained and continued health improvement, not only for the participant but for their families as well. Our program activities will be as such. So we will have monthly chronic disease and nutrition educational workshops. Those workshops will take place within the community at local areas if it's a hard structure, or if it's just out in the community, an area that people are able to access. Those will be our places of outreach. Additionally, we will have community blood pressure, blood glucose, and waist circumference screenings. So we will provide sort of that touch point where people can receive those services, have a good baseline. They know where we are and that we are coming to them in order to help them improve or change whatever it is that they would like to. Our next program will be that we have individual health coaching by trained community health workers. This is the area that we would also have our traditional healers come in place and be able to sort of bridge that gap between what the Indigenous people prioritize and value and sort of this Western modern medical healthcare system that we're trying to use and bridge the gap to do. And our last program is to provide referrals to local healthcare facilities, for participants with those abnormal screenings. So anyone who is identified as having high blood pressure, high blood glucose, or elevated BMI and high waist circumference, we would hopefully get them together with a healthcare provider that's local to them in order for them to address and move forward with those concerns. Slide 9 details our preliminary budget. So we're grateful for the $10,000 initial seed money. We have also garnered 10,000 additional funds from other organizations. And so our biggest piece of our budget is going to be our community health worker stipends. We obviously want to support them and compensate them for their time and their efforts. Additionally, the next sort of big piece of our budget is going to be our health screening supplies. We would, hate to have people to come to us and not be able to give them the testing and the support that they need. So we want to make sure that we're supported there. And another large piece of our budget is going to be education materials that have also been appropriately translated. We really want to take the time to do this correctly and make sure that we're increasing that ability for people to meet people where they are. So that will be sort of the largest pieces of our budget. We will include transportation for our outreach teams, funds for administrative supplies, funds for nutrition sort of demonstration supplies, and lastly, funds for a program evaluation program. So those will be sort of the big highlights of our budget. And we've also discussed on slide 10 our funding sources. Again, the initial startup funds coming from Liberty, and we're very grateful for that. The Peruvian Ministry of Health, their sort of responsibility within Peru is to implement national public health initiatives, expand this preventative health care, and partner with other programs that have those services available, especially in these indigenous communities. So they were sort of our top reach out to also do this program. The Pan American Health Organization, They provide a chronic disease prevention grant, and so we've contacted them in order to utilize their resources. Again, this is something that aligns with their goals as well as ours, and they are a good match for what we're trying to do here. UNICEF, they typically, yes, work with women and children, but they are also recognized for supporting nutrition, health promotion, and community health initiatives that benefit families. And so we believe that our program does not just benefit the adult who's struggling with a chronic disease, but that the results of this program will help change not only their own lifestyle choices, but the lifestyle choices of their families, women and children included. And then lastly, we're reaching out to non-governmental organizations and faith-based partners to partner with us and support our efforts in decreasing these chronic diseases amongst this indigenous population. I have listed a slide of like special considerations because this is a sensitive but necessary project, I believe. So these interventions are designed with cultural values and lived experiences of the indigenous Peruvian communities in mind. Again, prioritizing providing education in indigenous languages, providing family-centered education and support, recognizing beliefs and ideas of traditional healing whenever appropriate and however we can incorporate that, as well as involving our community leaders and healers in the development and planning of the program, employing and utilizing indigenous traditional healers as well as community health workers from those local areas as they're able to and whenever possible, and then encouraging collaboration. I think the best way that we're able to bridge this gap is to show that we're sort of all working together for a greater cause. And so those are really the special considerations we're giving to accomplish a big goal that all of us need to be on board to achieve. Paramount to any successful program is the way that you evaluate that program. I've included a comprehensive evaluation strategy to determine whether the program is achieving its intended outcomes, as well as to demonstrate accountability to our stakeholders and our community as well. So I've broken up the evaluation piece into two parts. First will be the process evaluation. This will assess whether the program is being delivered as intended, if the target population is being reached. And so we'll do this by the number of participants enrolled. We'll also assess the attendance of educational sessions. Again, one of our objectives was to have people attend at least 4 of those sessions. So we will be tracking that with sign-in sheets and things of that nature. And then we'll also assess the number of screenings completed. So we're going to be doing these informational sessions on at least a every 3-month basis. And so we'll have opportunities for people to screen and be rescreened and follow up and things like that. So we want to be able to track those numbers and make sure that people are following up. Again, we'll also track the percentage of the number of referrals made, so we can capture, those people who are, triggering sort of that high blood pressure, high blood glucose limit, and then make sure that we're connecting them to the people that they need to be connected to. And then lastly, we'll be tracking patient satisfaction through surveys. So this will be, I feel like, one of the most valuable tools that we use because it will provide qualitative feedback into its cultural relevance, its accessibility, and the usefulness of the program. This is a community program, and we want our community to let us know if this is meeting their intended needs as well. So that will be sort of how we evaluate our process. The second part of the evaluation will be the outcome evaluation, which focuses on measuring whether the interventions produce meaningful changes in participants' knowledge, behaviors, and health status. So our first sort of assessment will be their changes in health knowledge. We will be using pre and post questionnaires to evaluate their understanding of chronic risk disease factors, their understanding of healthy lifestyle and nutritional ideas and the importance of preventative screenings. By asking before and after, we'll be able to see if our monthly knowledge sessions would have garnered them any additional information in helping them make better choices for themselves. Also, we'll be assessing their clinical outcomes with the biometric measurements that we're taking, the blood pressures, the blood glucose, the weight measurements. That will be evidence to how much our interventions are assisting. So we understand that it may take several years to observe large changes, but we think with these sort of intermediate indicators, we can see if there's at least a meaningful progress being made. Additional outcomes will measure the proportion of participants with abnormal results who also successfully attend a follow-up appointment. This is important because we don't want to just identify, we also want to provide the resource to be able to treat and move in the correct direction. So we want to know that our program effectively strengthens that continuity of care as well as reduces those access barriers. And then our last sort of evaluation, we will be analyzed at like 3-month intervals throughout this 12-month program. These findings will determine if our program has achieved its objectives. It will also identify opportunities for improvement, and it will provide informed decisions for future implementation. The goal of all of these sort of outcomes here. So we believe that by increasing our ability to track how well our community is receiving the program, we can improve, change, modify those things to make it even better. Ultimately, it's our goal to provide culturally relevant, competent, and sensitive care that is also going to be evidence-based and reasonable for people to access, use, and recreate. We don't want to just continue to bring information or tools that have to be provided for us, but we would like to get the buy-in from the community that says like, hey, we can do this ourselves, we can make these changes ourselves, and it doesn't have to change our culture, it doesn't have to change our beliefs, but it can make us better as a people, and we can continue to do this for future generations to come. Thank you all for your time, and have a great day.